Okay everyone, welcome back to my videos and I hope you're all doing well. So today I want to talk about 10 things that I learned in my first year practicing as a general dentist, about myself, about dentistry as a whole. And this is more of a reflective video because I sat back and thought about what did I learn, after a year of working as a general dentist, especially as one that did not go through a general practice residency or any specialty program. And so these are the 10 things that I learned in my first year. Okay, so the first one was that I knew enough dentistry to survive, right? So our biggest worry when you're coming fresh out of dental school is that you feel that you don't know enough to practice. And yes, you don't know everything and you might not even be great at everything, but you definitely know enough of the basics to be able to come out and figure it out. So that was one big thing, when I first came out. It's kind of like, well, your school prepares you a lot, but you're just not sure of how much you know. I remember my first 2 weeks just doing a lot of research, reading a lot of ADA journals, like preparing for all my patient cases, but still realizing that, when I walk into the room, I know a lot. You know how to anesthetize your patient, you know how to do a basic restorative procedure, you can do extractions and you can do dentures and you can do some simple endodontic procedures. So it's like, you know enough for day one, week one, month one, and of course dentistry, the better you are, the more you practice, the better you get at that. So that was the first thing I learned. And actually, on top of that, also I realized that I actually knew more than I thought I knew. So there'd be a situation in which, I would see something and all of a sudden the answer just comes to your head. The answer would just come to my head. I see something and you flash back, you remember that one PowerPoint in your class that you took, and you'd be surprised that you'd be right about that. But we actually know a lot more. Dental schools, I can't speak for all, but at least for mine, I went to University of Maryland School of Dentistry. I think we were really trained. We're trained very well, and a lot of things you surprise yourself. I said that in my first 2 weeks of working, I surprised myself several times with how much I knew as well. So second thing I learned almost immediately was that time management is key when you're working in the real world. Because number one, you have hygiene checks, right? So in dental school, we don't have any hygiene checks. My school had a hygiene program, but we didn't do their hygiene checks. So a hygiene check is pretty much when a patient comes in for their 6-month cleaning or periodontal exam or whatever cleaning they may have to be done with a hygienist. Every 6 months, the patient needs an oral cancer screening exam and kind of like a periodic check exam that needs to be done by the dentist. And so, you'll be in the middle of your procedure and then the hygienist will come let you know that they're done with the cleaning and the patient needs an exam. And so on top of all the patients that you see, you also have to stop your procedure or manage your time so that you can leave your patient, do a hygiene exam, and come back and finish your patient on time. So that was something that was new to me, because when you're in school, first of all, when you're in school, you have 3 hours with your patient and there's nothing else interfering. But when you're working in the real world, if you want to call it that, you have to stop and go and do the hygiene exams. And where I work, there are 2 hygienists. And they always usually finish just about the same time. And so, about 30, 45 minutes into procedure, I have to tune my mind that, anytime now, they'll come and get me. Or sometimes what I would do is if I'm at a good part of my procedure that I can stop, I'll just stop and go and check to see if they're ready for me. And most of the time, even if they weren't ready for me, they would still let me do the exam if they were done with most of their cleaning, because we still need them to have cleaned the teeth, a decent amount so I can look. Otherwise, if the patient's mouth is full of plaque, and then I'm not able to do a complete exam. So that's kind of something that I had to navigate in the field of dentistry. So that's number 2. Okay, so kind of touched on this already, but number 3 is to not be scared to ask questions to another dentist. When you're a new doctor, like I said, there are a lot of things that you do not know, or there are just better ways of doing things, right? So you may have learned one technique in school, and you only went to one dental school for the most part. And so you only know one way of doing things. And if you didn't work with several faculty in your school, then you only learned one way of doing things. And so you've come into your practice just doing that one thing. Maybe you're not sure about it, you're not confident about it, but just having the humility to ask. If there's another doctor in your office, feel free to ask. I never hesitated. The doctors that I worked with were great. They provided excellent guidance to me. I never shied away from asking a question if I wasn't sure about a case. I would discuss a case with them if I wasn't sure, because ultimately I want the best treatment for my patient. So it doesn't make sense to act like I know it all and then maybe go do something that's not the best for the patient. And so that's one thing I learned, to never be scared to ask. Never be scared to conduct your own research. So many articles online. The American Dental Association is a great resource site to go there and look up cases, read in your spare time. And just know that the more education you can give yourself, the better treatment you can provide. So that's one thing I also learned. Okay, number 4 is one huge thing I learned coming out is that your assistant or assistants are everything. They make the experience great, or they can make the experience sour for you as a general dentist. So if your assistant is a great assistant, keep them, value them, cherish them. So I have an awesome assistant. She has taught me so much. I mean, when I came in, like I said, when you're in school, you only know certain materials. You've only worked with so many materials, not that many, it's just the one liner that your faculty, that the school orders for you. It's the one, what else? Alginate impression material, or it's one tray, or even it's one type of burr that you're used to. But your assistant has most likely, they have experience, they've worked with several doctors. Mine has been in the game for about 15 years. She's seen all sorts of doctors, all different types of ways of doing things, and she's seen what has worked for some doctors and what hasn't. And she has been great in guiding me, helping me pick out better materials, suggesting better materials, recommending some materials. Of course, you still do your research, right? Because ultimately you're responsible for whatever materials or technique you decide to change to. But she has been excellent, I have to say that. And so having a great dentist assistant relationship is one of the best things that could ever happen. If you're a dentist out there, you guys know, what I'm talking about. If your relationship with your assistant is not the best, just every day is a drag. But if they're on the same page with you, they know what procedures. My assistant she goes far and beyond to make sure that every case is ready when we're started. She knows what I like. The great thing about having a great assistant is once they learn what you like, they're able to predict your moves. And so we barely speak during the procedure in terms of pass me this, pass me that, or pass me that. She knows she's one step ahead of me always. And so that's one big thing. If you can build that relationship, with your assistant, then dentistry, your everyday dentistry is going to be fantastic. Okay, so the next thing is that the speed at which you grow is so steep. I mean, like I said, if you come out and you didn't do a residency, you're walking straight from graduation day, or graduation, the week before graduation, you were only seeing 2, maximum 3 patients a day. And that wasn't even every day. I mean, if you were lucky and you were seeing 3 patients a day every day, that means you were really going at it in dental school. Most of us were seeing 2 patients a day. And that probably didn't happen every day of the week. So you were probably seeing no more than 10 patients a week. And then here you come to work and you're expected to see at least 10 patients a day, 15, maybe 18 on a really, really busy day, including, emergency exams and all of that. But there is no way to build up speed than to just be kind of thrown into the fire and kind of work your way through that. And so for that is the next point, which is at the same time, don't worry about your speed, right? So we worry about, well, how do I go from 2 to 3 patients a day to 15? Like, how does that happen? You can't even think about it. When I was in school and, the faculty members would say things like, I'm seeing 12 patients a day. I'm like, how are you seeing 12 patients a day? In school, we only see 2-3 hours per patient. And that in itself was a challenge, so you're thinking, well, How is it possible that you can see that many, and sometimes even more? I mean, I'm not even counting my hygiene patients that, the hygienists see. However many they see is however many you'll see. So I'm not even counting that. I'm talking about actual procedures that I'm doing. But then you realize that when you walk into a dental office, like I said, you have an assistant, and that automatically increases your speed. The fact that there's someone there to set up your chair, dental students know what I'm talking about. You have to come in early. First of all, make sure that your patient is coming in, right? So you have to be your own front desk and call them. Then you have to come in, set up your chair, get your instruments. And then when the faculty come in, you have to stand in line and do a start exam or start check. You tell them their patient's blood pressure, and then each faculty member has however many students they're covering, and so that in itself takes time. The faculty member sits down, checks it, you do the work, you have to wait in line again. Faculty member comes back, checks the work to make sure your prep is good, and then they leave, and then you have to fit. It's a long process. So you eliminate all the faculty checks. You eliminate the fact that you can have someone to suction for you, the fact that someone's passing you all the instruments, the fact that when you drop an instrument, you don't have to unglove and take it to the sterilization room and stand in line to get a new instrument and come back. Just eliminate all of that, and you realize how much time you save. And so going from 2 to 3 patients to about 10 to 15 no longer becomes crazy, because you eliminate, like I said, all the things that take away time, and you realize that you will build up speed. When I first started, my job was very gracious to me, knowing I was a new graduate, and started me on about 7 patients a day. So I was seeing a patient every hour and a half, or I was dedicating an hour and a half to each patient. And then it only took me about 2 weeks to get a good rapport with my assistant and kind of speed up a little bit. And then by the first, after the first month, I was back to seeing, I was seeing about 10 to 15 patients a day, and kind of navigating that. And so that's pretty much, what it is in terms of your speed. It will increase. You don't even have to worry about that. There's just no way you'll be seeing 3 patients in practice unless it's 3 huge cases, But the average general dentist is seeing more than 10 patients a day. So nothing to be worried about. Your speed will come. Don't even worry about it. If you'll be bored, because you'll be finishing your procedures so quickly, and you'll be on to the next patient. And so that's kind of how it works. So another thing I thought about was that in school you study, but in practice, or when you're out in the real world, you practice. So in school, you're just studying hard facts, you're studying the what ifs, you're studying the how to fix problems, and depending on what your patient pool is, you may never even see some of these cases, right? But when you come out in the real world, chances of you experiencing a lot of these cases is high, just because you're seeing so many patients. And so you realize that you are practicing exactly what you learned in school. And right in the line of that, my next point is that it's studying. There's no studying for anything anymore. So in school, you're studying for exams. You're going to be graded. You need to pass your exams. When you're out in the real world, nobody's asking you to study, but you realize that you're studying every day, because you're looking up articles, you're looking up case studies, you're reading PowerPoints, you're pulling up your notes from school, and you are studying. There's no exam, because every patient is an exam. You have to pass every exam if you want to provide great patient care. And so that's kind of another thing that I realized, that in school you're just studying just to pass. You're studying for your profession, but you do want to pass. And then when you come into the real world, there's really nothing to pass. You just have to make sure that you're giving your patient the best possible treatment. Okay, so I think I'm on number 8 at this point. Is one thing that I've learned out in my first year is to only practice the type of dentistry that will make you sleep at night. And I say this to say ethical dentistry. I practice ethical dentistry, and I hope everybody does too. But that's one thing. I always, joke with my assistant that I'm not going to do anything for which when I go home, I can't sleep at night. Because you will realize, when I was in school, there were some cases where it's not that you're trying to treat the patient incorrectly, but something happens, maybe it's a surgery, and then it became a surgical surgery. And then you go home really thinking hard about it and unsure of what happened during the procedure. So as a new dentist, I told myself ethical dentistry is just the way to go. You can sleep better at night. You're not worrying about anybody saying any, thing bad about your work. Yes, of course, things happen. Yes, of course, things don't always happen perfectly, but as long as I know that I put my best foot forward, in the same vein, be nice to your patients, right? Because if you're nice to them and something does not go as planned, they're more likely to forgive you or be more understanding. And so that's kind of in that line as well. Okay, so the next point, one thing that I remember from school, one time a professor mentioned to us toward graduation, I think I was at a rotation, and he mentioned that when you get out into the real world, nobody is watching over your shoulder. Nobody is checking your preps. Nobody is checking your contacts. Nobody is checking your occlusion. You are fully in charge. If you do crappy work, it's you. No one's going to check it. The patient will never know for the most part. They'll just think that their teeth are bad. They'll just wonder why they're always, it's like they have their filling done and the next time they come, the filling, fell out, or there's a new cavity under the filling or whatever. Your patients are trusting you. And that really sat well with me and sat deeply in my heart, because it's true. When you go to your regular doctor's office or any doctor's office, you're trusting that they're giving you the best advice, they're giving you the best opinion, they're giving you the best treatment plan, they're giving you the best solution. You can go for a second and third opinion, but most people will just stick with whatever the first doctor is saying. And so in that same vein, when I'm doing a procedure, I'm giving my best, because this patient is trusting that whatever cavity it is, I'm taking care of it. Yes, things don't always go as planned, and that leads me to my last point, to like I said, be nice to patients, but then own up. If you feel that the work that you did that day, the patient comes back 6 months later for a hygiene exam, and the filling, they took bite wings for as a periodic x-ray, and you see that, the filling that you did has an open margin, or is overhang, or just doesn't look that, it doesn't look the best that it could ever look. Own up. I'll be the first one to tell the patient that, that filling that I did last time doesn't quite look great. Let's schedule you to come back so I can redo that at no charge. A patient would appreciate that, rather than you blaming them or saying that you need to brush better, you need to floss, which is true, but you need to floss, and that's how you have a new cavity. We all know what type of work we've done, and I think it's great to be nice to patients. Of course, not everybody has great oral hygiene, and not every new cavity or recurrent decay is the fault of the dentist. Of course it's not. But we all know what we're doing. If it's a patient that has great oral hygiene and then it's an overhang, I try to bring the patient back in and redo the work at no charge. And I think patients have more respect for you that way, because they realize you're not taking advantage of them. You really care about their work, about their oral hygiene, about their oral health care. And so these are, I don't even know what number that was. I think that was 10 or so. But these are things that in my first year out after working, I have thought about, reflected on, and things that I think a lot of people will resonate with their first year out. Everybody's experience is different, of course, but I'm curious to see how much better I become as a dentist in my second year now and beyond, because in my first year alone, I have learned so much, and it's incredible, and I'm really excited to see what else I can learn, and how, what bigger cases I can be involved in, and all of that sort of thing. So I hope you guys enjoyed this video. If you caught me looking down, it's just because I was reading my computer some of the points. But take care, and I will hope to be making a couple more videos soon. I do have an Instagram page now that I'm trying to keep up with. It's hard. But that's my Instagram name on the bottom if you want to go ahead and follow me there. I will start to kind of post a little more about dentistry and possibly some of the cases that I work on that page. But for now, it's just kind of tips and oral health care advice and all of that. But okay, so if you guys have any questions, feel free to send me an email, or you can just comment down below, and if I see it, I will go ahead and respond. You guys have been great. Take care. Bye-bye.